Hi, my name is Jim Cho from Cedars-Sinai Medical Center, and I'm here to talk about my research project entitled Immunosuppression Does Not Influence the Decay of Pneumococcal Titer 3 years after vaccination. According to Center for Disease Control's Advisory Committee on Immunization Practices, the 23-valent pneumococcal polysaccharide vaccine is recommended for susceptible individuals with immunocompromising conditions. This includes those with inflammatory bowel disease. A second dose of vaccine is also recommended after a 5-year period for the immunosuppressed population. In our prior prospective study, it was found that 4 weeks after pneumococcal vaccination and administration, patients with inflammatory bowel disease had a blunted response to pneumococcal vaccine while on immunosuppressive agents relative to matched cohorts with IBD on no immunosuppression and healthy control populations. In the current study, we assessed 3-year post-vaccination titers to determine whether immunosuppression or IBD influenced long-term vaccine response and if booster vaccination is warranted sooner than guidelines suggest. All 64 subjects from the original study were contacted for follow-up. Group A consisted of IBD patients with concurrent anti-TNF agents and immunomodulator therapy. Group B included IBD patients not on any systemic immunosuppressive regimen. Group C subjects were healthy, age-matched non-IBD patients without immunosuppression. Interval medical history, including hospitalization, medication change, and pneumonia instance, was gathered. Serum was obtained as well. Assays for immune response to 5 serotypes were performed using ELISA and compared using ANOVA and adjusted student's t-test. Log plots were constructed to assess differential responses based on the level of the 4-week titer. Immune response was defined as greater than 1 microgram per milliliter. 27 subjects completed follow-up, 8 from Group A, 10 from Group B, and 9 from Group C. The median age of returning subjects was lower in Group A relative to Group B and C. Absolute titers to 4 of 5 serotypes were numerically lower in Group A than in B and C, but were not statistically different across the 3 groups. There was no evidence for a differential response at 3 years based on 4-week levels. Decay of antibody titers was similar across the 3 groups. Among those in response at 4 weeks, the durability of response was similar across all groups. Within Group B, 3-year response rates were similar among 4-week responders who subsequently started immunosuppression relative to those who did not receive immunosuppression. No subjects reported interval pneumonia. In conclusion, 3 years after pneumococcal vaccine, durability of response does not appear to be influenced by immunosuppressive therapy or IBD as we initially hypothesized. Early booster does not appear to be warranted among those achieving initial vaccine response, regardless of immunosuppression status. Functional assays may help to clarify the implications of low titers. Thank you for listening.